Okay, so this is the second question. I used the implant for 2.5 months. Bleeding lasted for 2 months and I had to remove it. I've been using a low-dose contraceptive pill since May 25th. My bleeding continues. By the way, this question, I think it arrived yesterday or the day before. So May 25th, so what are we looking at? 2 weeks plus now? My heart goes out to this lady who used the implant for 2.5 months. And if you're here or you're watching this and you don't know what the implant is, they're talking about the contraceptive implant that contains progesterone that is put underneath your skin, usually the skin of your arm, your upper arm, and you can have this in for for years, and it provides contraceptive protection. So it gives you contraception for that period of time while you have the implant in place. And of course, the benefits are you don't have to worry about taking a pill every day or putting a patch on every week, or putting a ring in, or if you've got a regular partner, using condoms, and so it gives you that degree of freedom, if you like. And so it is effective in the sense that it's not relying on the user to do anything in particular. So of course it's more effective. It has a higher effectiveness rate compared to things like condoms or things like the pill. So it's got quite good, it has good statistics, but of course, like pretty much all devices, pretty much all methods, there are some downsides, there are some side effects, and this is one of them: irregular bleeding. So this is I say it in my videos where I talk about birth control, and please go and check out my smart birth control playlist. I do talk about a lot of different things around birth control, particularly emergency protection. But it's important that if you experience side effects that are distressing, that you cannot tolerate, you should be speaking to your provider, your healthcare provider, about changing or other measures that you might use to address the problem. Yes, it is true that when you first start a method, you might need to give your body some time to get used to it, to allow hormone levels to sort of settle down, and then things can progress smoothly. And generally, doctors will say to you, look at 6 to 12 weeks of patients with this particular procedure. But that's if it's not causing havoc in your life. So if it's giving you headache and giving you all sorts of horrible problems, please go to your doctor and say, can we change this? Can we remove this? Now, this question, this viewer, and thank you for the question, didn't tell us what type of bleeding. And again, this is why I don't tend to provide much detail about this kind of comments, or to this kind of comments. Much appreciated, that's true, but it's good to take the discussion away from the comments section, because there isn't that opportunity to gather all the information. And just to remind you that we also have an email health information and advice service on our website, www.AskAwayHealth.org. In fact, I will try to share that so that you can see the channel. Just give me 2 seconds so I can pull it up and show you. So if you go to AskAwayHealth.org, that's our website, and if you go to the top right hand corner, then you will find our email service. I'm going to show this to you if I can. Yeah, so if you click on the email service here, top right hand corner, so it opens up to our email advice service, okay, which is a free service, but we do take a minimum donation to allow us to make sure that there's enough hands that are able to manage the volume of questions that we get coming in. But you do get a direct response to your inquiry that is detailed to whatever health inquiry that you provide, and you can use this if you want to clarify, get specific information about it. It's very easy to use. Just provide some details and then give us as much information as possible about the problem so that we can attend to it and attend to you. So that's AskAwayHealth.org, the email service. Please use that if you want to get more information about a particular health related question. So back to this lady has been having bleeding, lasted for 2 months, so she's given it about 8 weeks, which I think she's given it a reasonable amount of time, and she had to remove it. So yeah, don't be afraid, don't be intimidated or silenced. Insist that this is causing disruption to your life and you can't tolerate it, because it can happen. These methods can be very effective, but for some women, the different types of side effects. Now she says, so this is the question: I've been using a low-dose contraceptive pill since May 25th. My bleeding continues. So one of the ways that we can use to treat this problem, to manage this problem when somebody starts a new contraceptive method and then they start having abnormal bleeding, it is one of the ways. Of course, it's possible that you just stop it and I'm not having this anymore. Another thing to do is, after stopping it, how do you get the bleeding to settle? What do you do? It's important to get as much information from the lady as possible. Make sure there's nothing else going on that could explain the abnormal bleeding pattern, a sexually transmitted infection or some other condition. I don't want to generalize, but we have to think about other possible causes. And then if it's none of those, we can narrow down and say, right, this is a side effect of this medicine. What can we do in this instance? So the possibilities are to use medicines to control the degree of bleeding. There's some that are related to ibuprofen and aspirin, for example, tranexamic acid, that you may be able to use to control the bleeding and make it lighter. These are non-hormonal, so they don't contain any hormones. That is one option. But the option here that's been used here is the low-dose contraceptive pill. Now, this is most likely a low-dose combined contraceptive pill. So that's the combined pill that's being used to help to calm the bleeding down, which it can do because it will help to regularize the cycle. So what it does, taking the combined pills on a regular basis switches off your body's natural hormones temporarily, because they've sort of taken the implant has they've just gone haywire basically, and it might take some time before they sort of settle down and go into a smooth pattern. So by taking the combined pills, what they'll do is shut off your natural hormones for a time so they can rest. Any bleeding that you experience subsequently will be the effect of those hormones on your womb lining. So the question she's asking is, how long does she have to bear this because she's still bleeding? Well, again, it varies from one person to the other, but I would expect that this bleeding should calm down as the effect of the low dose combined pills gets into her system. So she started taking them. It's now 2 weeks. I would expect that by the next time, or within the next 3 to 4 weeks, her bleeding should be settling. She should be getting into a pattern of only a withdrawal bleed when she stops, when she goes for her pill-free period. If she's got a pill-free period, when she starts taking the pill again, then she's got bleeding-free days, and so it looks as if she's having a regular cycle. But please remember that, again, it takes some time for the effect of these hormones to build up into your system. Remember that at least taking them for the first 7 days to build up contraceptive protection, and then they begin to shut down any other type of bleeding. Those will probably take a few more days to kick in. So I do think that within the next 1 or 2 more weeks, this bleeding should settle down. And I think that if it isn't, or it's getting heavier, then you should be speaking to your doctor again. And again, this is broad information, literally, we've just got 2 lines of information here. But given that this is being used to treat abnormal bleeding that started as a result of the implant, then it's reasonable to suggest that it's probably the combined pill that she's using. And the effect of the combined pill will be to lighten her bleed and help get a cycle that's regular. And it might take a few weeks for that to happen, and so hopefully, it's because she's been doing this for a couple of weeks now, so hopefully she should experience a better pattern, I think, within the next couple of weeks. Otherwise, then she should be having that chat with her doctor.